I'd say over the last maybe 3 to 5 years, there's been a lot more push for specifically looking at what is this experience like for women? How do we understand, what the counseling looks like before and afterwards, and what are the unmet needs here, and involving patients in those discussions. And urology has been predominant, very male dominated, and that is changing. There are more women in urology. There are more women urologic oncologists, and so I think that there's maybe been a push from some of the younger urologic oncologists to talk about these things and talk about how we can maybe refine or change, modify some of our surgical techniques, of course, without compromising, patients' outcomes long term. So that's one of the things that I think has been great to see, a lot of the focus on that. And then from in terms of the diagnosis standpoint, there's been some really, I'd say the work that's being talked about right now here, and ways potentially to screen better, diagnose earlier are really exciting. It's really exciting to hear, some of the stuff that people are working on. And a lot of that is, are there urine-based tests that maybe primary care docs can do, like at the same time that will say, oh yeah, you came in, you had some blood, or we think you have these UTIs. We can actually screen you right here, or we can check. I think we're potentially a little ways out from that, but that, if we have the ability at some point in the future to do that and identify these, patients earlier, I think that'll be a great step forward for us. And then I think the other piece is really actually trying to educate patients. And it's interesting. I had been over, I think it was maybe in London, but I feel like in the US, sometimes you'll see like billboards about, isn't it like getting your colonoscopy maybe, or, Katie, somebody's getting a colonoscopy on TV. Nobody really ever talks about, oh, like blood in the urine is not normal. And over in the UK, they have like posters up on the trains that are like, oh, if you see blood, call your doctor. And somebody just sent one, I think it was in Canada, like yesterday or the day before. Like they have like signs up at bus stations and on the trains, like this isn't normal, call somebody. So I think as hopefully we get that out to patients as well, they'll be able to, again, hopefully advocate for themselves and get in a little bit earlier. And actually circling back to your first question, and things I think are coming down in the future is a lot of really like the basic science, like the sequencing of cancer and the cancer biology is getting more accessible and accessible to researchers. I think there's going to be a better understanding again of why on a stage why do women have more aggressive biology? Is there something, again, is there something at a very unique cellular level that is driving this? And I think we're getting closer potentially to understanding a lot of that stuff, which is awesome. And I said, even in my training, I've been, between residency, fellowship, and now in practice, it's been about 10 years. And when I started, we had one chemotherapy for patients with bladder cancer, or with 2 options basically, but it was like, that was it. And there hadn't been anything in 20 years that had changed the non-surgical care. And now, there are so many drugs available for patients with more advanced disease, for patients without, advanced disease. We have a lot more options for bladder preservation, which is also great, for cancer in the bladder that maybe doesn't respond to the one disease or the one treatment that we have. We now have more. There's so many more drugs in development. And there's a lot of interest even in preserving the bladder and treating with chemotherapy and radiation instead of with surgery. And that's becoming a little bit more widestream or widely accepted, a little more mainstream. And so I think there's a lot of exciting stuff, and hopefully we can continue to make advances and improve the care for our patients.